Hi, this is Sonia Frausto for Case Study 5.1 for Core 6323. All right, so today I talked to Jerry over the phone. He reached out to me and from a short conversation told me he needed my help. Now, from our talk, Jerry told me he was 56 years old, is what I know from him. And he said he urgently needed to see someone due to a meaningful relationship that had recently ended. Luckily there was a spot that someone had that opened up and it had canceled, and so therefore I was able to see him. Now, due to the nature of Jerry's request and from what he said, and I did notice that he was a little cautious, that he wasn't very confident in seeking help, that he asked me some questions. So, not fully knowing whether he could trust me or did, and so forth. And due to that, and also the nature of a relationship ending, which we know that relationships can increase the risk of depression, anxiety, stress, or even suicide. I don't know the extent of that. I chose to see him along with a colleague due to his safety and mine as well. Again, I don't have a lot of background. I just spoke to Jerry today and I will see him today. And so I thought of his safety and mine as well. And of course, made sure to get his consent before I did so. I told him that I would be seeing him today with somebody, and if this was okay with him, then we could proceed. And I explained that this was due to the lack of background between us, and he was okay with that, so we will proceed. Now, once in my office, um, to begin with, I will talk to Jerry with some motivational interviewing. I will implement that so that I can assess his needs. Okay, to ease his insecurity, first of all, I will, and lack of trust, if you will, I will affirm my professionalism to him. I will tell him that confidentiality and privacy is my utmost concern. And I will, of course, show empathy as a person and let him know that relationships are hard, that relationships are complicated. And I will not contradict anything that he has to say or otherwise, and so I can validate his feelings and therefore make him feel as comfortable as possible. And of course, my question to him will be, how can I help you? Why, what he assumes that the extent of my help will be, and of course be completely honest to tell him how I can help him based on what he has just told me. Now, if during this time I see that Jerry is not stable, and during this assessment, and he's maybe uncooperative, argumentative, or maybe just simply not in a good state of mind to where we can have a conversation that will develop into some sort of counseling, then I may seek help from either my supervisor or maybe a colleague that is more experienced, who maybe can suggest another route to take at this time. Maybe they're involving isolation, if that be the case, or some sort of medical treatment, if based on what we talked about may be better to help Jerry. So finally, in reference to our case study and suggestions that were proposed, I would definitely, first of all, make sure that I remind Jerry during the initial assessment that he is in a safe place, that I am only here to help him, and that anything that he says is confidential and will remain completely private. I will do this to ease his mistrust and hopefully get him to open up a little bit. I will make it clear that I can only help him if he is honest, and also affirm that I can only help him to a certain extent and let him know based on what we've talked about. So I will be honest myself in what I can offer to do for him. Okay. And then from his answers, I will also assess any type of factors such as social, cultural, or any type of environmental, maybe based on his relationship, how that could affect or impact or anything like that. His emotional, how it could impact his emotional state, and hopefully it not develop into an emotional crisis. And just based on what he's willing to tell me at that moment. And then finally, from there, assuming all went well, I will determine my strategy, my resources for helping him. I will determine whether I need to reach out to another um, agency or anything else that he might need at the moment, or whether we will continue therapy, or what other resources can be provided for him and to help him best. Thank you.